You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to the MaternalRx podcast on the Pharmacy Podcast Network. I'm your host, Dr. Danielle Plummer, pharmacist and doula, and so excited about today's episode. It's taking us in a different direction from my previous interviews. It's a deeply personal conversation about infertility, grief, resilience, and the many paths families take toward parenthood. I'm joined by my mentor and former manager, pharmacist Willie Bawarski, and his beautiful and incredibly kind and amazing wife, Olivia, who share their lived experience navigating infertility, the emotional and financial realities of IVF, and the unexpected turning point that led them to foster care and ultimately adoption. Together, we explore what it means to hold hope alongside uncertainty, to love without guarantees, and to redefine family in ways you never planned for. We also reflect on the unique role pharmacists and other healthcare professionals play during infertility and IVF, often as steady presences during some of the most vulnerable moments of a patient's life. Willie, Olivia, thank you so much for coming on and telling this story. So my first question for you is, before infertility entered the picture, what did you both assume the path to parenthood would look like, and how did that assumption slowly unravel?
I think that we pictured parenthood to become like any other couple, where we would try to have a child naturally, conceive, between us. After multiple years of trying, we realized that maybe it wasn't going to happen naturally and that we should probably go to a doctor and just figure out if there was something else going on. And sure enough, when we went, we figured out that we had a few things going on with infertility and that our path was kind of leading us into a different direction.
You make it sound so simple and black and white, and we know that's not, take emotion away from that, right?
Yeah.
But then when you add emotion, the human experience through that, it's not so black and white. Can you walk us through what those years of trying and eventually IVF actually felt like emotionally?
Yeah. So I guess the kind of loss, it was disorienting because the world keeps moving and you're internally recalculating everything. And you're really just carrying this invisible burden while it's all happening. And I guess we just assumed that the effort would lead to our desired outcome, because typically, or at least previously in our lives, that is how things worked. And then this really just threw us for a loop.
And I think I might have been an intern under you at that time, potentially.
Yeah.
And yes, I was one of those people that didn't know better and said, I love you guys. You're so beautiful and so smart. You have to have children when you get right. And I regret that, and you handled it with such poise and kindness. And it wasn't until years later, that I learned, you said we're going to foster. And I was like, oh, wow. I just can't thank you enough for not just shooting me down in my space or just breaking down in front of me, having that struggle. It just brings to life how other people don't know what coworkers or friends are actually going through. A lot of times what you see online or what you see in the workplace or out socially doesn't tell the story of what people are experiencing inside. Can you walk us through what those years of trying and eventually going through IVF actually felt like emotionally, and how the financial reality of each cycle shaped the decisions you were making month to month?
Yeah, it's really confusing because, like you said, it's just not really talked about. And so for us, we're kind of navigating through this situation, not really knowing. Although I will say, and I'm sure she's okay with me mentioning this, my sister also went through IVF and infertility, and so we kind of knew what to expect because we saw it. But until you go through it, you don't really know how it's going to feel emotionally, right? So you're thinking you have this plan and you have this all in place of what's going to happen and how it's going to happen, and then it pivots, and you're kind of mourning a loss of something that didn't happen, which is confusing. And, when we started going through IVF, we were very hopeful. But the reality is, like, our insurance, unfortunately, did not cover it. And so you're talking about multiple thousands of dollars, right, per round. And that can be a lot for many, many families.
As Olivia alluded to, each cycle does have a real price tag attached. And you start making decisions, whether they're emotional, financial, moral, and it's all coming at you all at once. And really, not everyone can just keep trying, over and over again without risk of real harm. And I guess in terms of the way that pharmacists may often see this is where cost-driven care decisions and even financial toxicity can quietly enter that picture. And pharmacists will often see this up close, whether it's through coverage gaps, prior authorizations, refill frictions. It's more just knowing that this is occurring every day, whether you're aware of it or not. It is happening day in and day out.
So, Willie, for a retail pharmacist, is there any advice that you would give them if they see those patients coming through and picking up their IVF medications?
Yes, I guess I think a lot of it is in those small moments. A lot of it can be the words we use, the tone that we use, possibly even the assumptions or the implicit bias we may have, or the decision not to assume anything at all. I guess I think it's more about the continuity of care and the presence, your presence as, one's pharmacist, that are very underrated. They're very underrated clinical interventions. And the fact that, you are trusted and your words actually often have even bigger meaning than you would expect. And I guess for me, when I was working in a retail pharmacy, which was for about 15, 20 years, I really just had a goal every day that I would just show up and I would genuinely help one patient that day and truly make a difference in even just one patient's life, every day. And really, if this can even help, one pharmacist or one listener feel less alone, or learn a little bit about this, or help really have more of an understanding or help to navigate the process, then this is all worth it for us.
Thank you for sharing these statements, because we know the role of retail pharmacy, at least in the United States. It is draining. Is exhausting. You're being pushed out from your corporate leadership and pushbacks from insurance companies and doctors that might not be having that cohesive continuity of care that you described. And it's very easy to get burnt out and bitter in that retail space. Bring back that human emotion. You are one of those leaders, those why I call you my mentor all these years, because I watched how you can push all that aside that's being around you. And when that patient comes to the counter to pick up their medication, you were able to deliver still that care. Like you said, that word, if you could change, give hope, give support to even just one patient, that leads to many more than just that one. And it's a good reminder for our pharmacists that feel that struggle of going to work every day, being pushed to the brink of what they can handle physically and emotionally, and bring it back to reality. And remember, why did we choose this profession in the first place? So I just, again, want to thank you for bringing that and giving the care that you need to the patients going through this journey, even long before you knew that it would be your journey as well. Right? Olivia, did you want to add anything to that?
I think, in any situation that's difficult for people, it's just, validating feelings, just listening. A lot of times people just need someone to listen to, or to listen to them. And I think it's just helpful to have somebody that just, like I mentioned, just validate feelings, right? Like there's no necessarily an answer. There's no, this is what you need to do. It's just, I understand that you're going through this difficult time. I'm sorry you're going through it.
What I find very interesting, Lily, working in healthcare, still the insurance wasn't going to cover each of these cycles or determine how many cycles. Like insurance companies, we know they really do dictate care. But when you're talking about becoming parents, each one of those cycles does make that big difference. When IVF wasn't giving you the clarity or outcome you hoped for, what led you to even consider foster care as an option?
So first, we did look at regular adoption. Just after having gone through IVF, we're talking about finances and thinking about your financial future. We did look into regular adoption and finding that also that was very expensive as well. And that's the reality of it, right? So you have to kind of put it all together and figure out what is your best path. And we understand that foster care is not necessarily everyone's path. It's not for everybody, but we were open to it, mainly because Willie's sister fostered a couple children for about 2 years. And we saw her journey through foster care. And my sister was just involved with some foster care organizations and things like that. And so we figured we should at least consider and give it a shot, or at least, get information and inquire. So that's where it started.
Yeah, I think just seeing all that up close between my sister and Olivia's sister made foster care feel a lot more real, like a lot more of a real option. Nothing that was abstract or theoretical. I guess it had quietly been in the back of our minds all along. We just didn't realize, that we may be going down that same path. And I guess it kind of reframed family for us as well. I guess something rooted in like nonlinear care journeys and ethical caregiving. It's more of, I guess, like a modern family where, it doesn't always look exactly how you planned.
And that's okay.
And that is okay. That's what we've taken on.
It's not just okay, it's beautiful and brilliant. And I've seen the family you've created. There is a shining light. Absolutely. And, once you can come out of that time you went through the grief, right? Like you said, mourning the loss of something that didn't happen. Physical toll, the financial toll of IVF. You shared that you walked into your first foster care class expecting to walk out. What shifted in that room that made you stay?
Quite honestly, we walked into that first foster care class guarded, exhausted, probably just, emotionally just drained. And fully expecting to leave halfway throughout the class. But I think what stopped us was our instructor and her honesty and how real she was. She didn't really sell us a dream. She wasn't trying to minimize the difficulty that we may have been going through. She really just spoke plainly about loss, uncertainty, attachment, heartbreak, really all of those things that were hitting hardest at that time. And I guess it created a sense of like psychological safety, which, in terms of for pharmacists, that's something that patients would crave in healthcare too. Whether it's in a pharmacy, it could be in a whole different walks of life, but I guess just being trusted with reality is almost always going to be better than appearing or seemingly like you're being managed with reassurance, or you're given words without that full dignity and respect behind them.
Powerful statements. Olivia, what about your experience when you walked into that foster care class?
I think I didn't really have an expectation. I was just trying to stay as open-minded as possible. But like, as Willie mentioned, I did think that after the first class, we were both going to be like, okay, this isn't really for us. But there was something about the way the instructor, like Willie said, spoke to us. She was just very honest, very real. And then just kind of giving us the reality of what foster care situations are like. In our town alone, there was 3,000 kids.
Wow.
In foster care that needed a place to stay, right? So I think it kind of shifted to being able to help And then hopefully along the way, we would be able to build our family.
Once you make the decision that you will move forward with fostering, what's the next step in that?
It's a process. You have to get licensed. And so you're doing home studies, you're meeting with social workers, you're getting your place safe and ready for whoever's to come. Of course, you pick an age range that you feel most comfortable with. And then once the whole process is done and you're licensed, then they'll start calling you, and they call you with different cases, and they tell you the ages of the kids that are available and what their circumstances are, and how they ended up in foster care and all sorts of things like that. Yeah. And the stories, they can be kind of crazy. So you have to prepare yourself for that, right? Yeah, it's pretty wild.
How did fostering loving children without guarantees change the way you think about attachment, loss, and what it means to be a family? And before you answer, I just want to add, when you have children through natural childbirth, there's still no guarantees, right? But fostering adds, I guess, an extra element to that.
Yeah, for sure. Because at any point, you could get a call saying that they're going to go home. And so, yeah, you just have to be really open and prepared. I mean, I think that we stayed pretty guarded throughout our whole process until adoption day. I mean, nothing's official until it's signed, sealed, delivered, of course. So you kind of just have to be okay living in the unknown, which is uncomfortable, but that's what you have to do.
Yeah, a lot of it, you're asked to love deeply without any control over the outcome, which I think was fairly unfamiliar territory for us. And then knowing that loss is part of the deal, it's part of the journey. So I guess at first it was quite scary, but then over time, we did, learn a lot. We did develop and kind of just realize, just to meet the situation exactly where it is, to meet that child exactly where they are, that our presence really mattered more than the permanence of it all. And really, love was more, it was more than I guess just the outcome. It was more, just I guess injecting love into the whole situation really just taught us a lot about attachment, resilience, and just showing up for people.
Wow, it's really incredible. Do you remember what was the timeline from when you first went into that foster care class until you fostered?
I think it was, our classes started in August of 2019. We started fostering in November of 2019. And just to put it in perspective too, we had 4 kids come into our home within 30 days.
Wow.
So it was like they just threw us right in there right in the beginning. And then we got our now adopted children right at the beginning of 2020.
What made you make the decision to go from fostering to adopting?
That's a great question.
I think it happens naturally, but I think, we were already in the space of fostering with really the eventual goal of adopting. And there was kind of a nice saying that we were, I guess almost became like a mantra at that time. It was, that the children will come into our lives. It could be for a reason. It could be just for a season, or it could be for a lifetime. And we knew that our eventual goal was, to have a family from this. So it did kind of nicely align with that. But I guess we also just understood and accepted the fact that, it was out of our hands. It was more just about the process. And if it was meant to be, then it would be.
Yeah.
And you really do have to live by that line of thinking. As pharmacists, we're so concrete in what we do, and we're trained, right? Always find the right answer. So when you have something in your personal life where the unknown just has to be the way you live by, Olivia, when you said that those children could be returned at any time and it's really out of your control, that's something really to wrap your brain around and accept. Doesn't come so easily to do. It takes time and lots of patience, right? And really, as you just said, a belief that what's meant to be is what the outcome will will arise. So really an incredible story. And I know you ended up adopting siblings. Is
Yeah.
that was that your choice? Was it suggested to you? How did that come about?
That also just happened. It just sort of happened. Yeah, it worked out. It just worked out that way. We got our son in the beginning of 2020, and then our daughter was born in August. Um, and of course, she needed a place to stay. And so we were like, we will happily take her in. And then, yeah, so it just kind of unfolded naturally.
Incredible and just so beautiful. And prior to hearing your story, the two of you going through this, I always thought that it was lucky for the children, right, to have parents like the two of you. But I see now it's all of you, that you, hearing you talk about your children, you just shine and glow, and I hear the joy and the laughter. I'm going to bring it back now to Willie as a pharmacist and as patients, both of you. How did interactions with healthcare professionals, especially pharmacists, affect you during infertility and IVF?
So, I am a pharmacist, and I guess it just seems like pharmacists are often the most consistent healthcare touch point during IVF, or really when patients are going through almost anything. It's a lot about the accessibility. I think a lot of it was, just because the pharmacists are there, they're there. They're a lot more. You're seeing them a lot more often than the physician. And I think a lot of it's not like the medication counseling or anything that was like that really stayed with us. A lot of it is just the words that are used, the tone that's used, the assumptions that are made, and really just not feeling like we were being interrogated, but really that, we were being listened to, and, that every once in a while someone may really understand. They may be going through a similar struggle, and that, you can be, whether it's possible you could be a shoulder to cry on, or an ear to bend, or just someone to lean on. But, sometimes, people are going through things that you don't see, and it's often the case. And just someone there that, can even just appreciate that, or just kind of take in that moment, even just with a pause or a recognition or just a kind word, it could really make all the difference.
Absolutely. And we touched upon this a little bit earlier, but what language or behaviors from healthcare professionals felt supportive? And on the flip side, what unintentionally made things more difficult?
I don't necessarily think it's solely just pharmacists, right? I think it's just people in your world in general, but obviously definitely helpful for healthcare professionals and pharmacists to be intentional about what they're saying and just being mindful. I think I mentioned before, from stories that I've heard, it seems that patients do oftentimes unload some stories to pharmacists and let them know what's going on in their lives. And I think, as I mentioned, just validating them, just saying, I'm sorry you're going through this. It sounds like a lot. Or just saying things like that are very, very helpful. I think sometimes, intention gets wrapped up in what people say, and people have really great intentions and they want to be helpful, but sometimes the most helpful thing is just listening and just acknowledging, instead of saying, well, maybe you could try this, or at least this didn't happen, or everything happens for a reason. I think there's being mindful of your responses, and honestly, it's just listening and acknowledging.
Words to live by, and it goes hand in hand with parenting, or oftentimes a child would come to the parent and state a problem. And where I come from, if you bring me a problem, I'm going to tell you my solution,
Right.
or what I'd recommend. And then I learned while raising my children, sometimes just stay quiet. They just want someone to listen and know they're there to support them. And that's the same situation, which doesn't necessarily go in hand with the training of a pharmacist or other healthcare providers. We're the problem solvers, and it's not natural for us just to stay quiet and listen. And so this is just great piece of advice, Olivia. For someone listening, for someone listening who is in the middle of infertility or who simply cannot afford to keep trying, what do you want them to know right now?
I guess I just want them to know that their worth is not proportional to how much they can spend or how long they can endure this process. It's not intended to be a moral test, and it's not really intended to, test your financial limits. And none of these are personal failures. Stop, pause, pivot, whatever it is. Just take a step back, to kind of reflect, and then as a pharmacist, and as many who are listening are pharmacists, just also realize and maybe better understand that oftentimes this is kind of a result of, it could be like health inequities, it could be access barriers, and it's rarely a lack of desires. A lot of it really just comes down to just being there, just understanding a little bit more of what someone may be going through, and realize that every family looks a little bit different. There's really nothing that's linear, or nothing that is just, I guess, assumed. And I think from there, that is a very nice starting point to build that much needed trust and respect between the patient and the pharmacist.
And that's our goal as pharmacists, right? We're the most trusted healthcare provider and the most accessible. And what you just described fits that in line with the modern family. Family is what you make of it, what you create, and it might not always be what you had expected when you were younger or growing up or getting married or have a significant other. And it's your decision and nobody else's. And I know that mom guilt can kick in really early as soon as you even think about becoming a mom, Olivia, right? I've dealt with it in other situations. And my piece of advice here, having not gone through this, bringing it back to what you were just saying, what your journey is just that. And it doesn't correlate to your self-worth or your ability to parent. And what you've created is just absolutely this beautiful family that is yours and unique, as each family is out there. Any last pieces of advice? Willie, you were my mentor as a pharmacist, but now the two of you are this guiding light and shining example of beautiful outcomes in the case that pregnancy journey that you had envisioned doesn't come to fruition, and you pivot, Willie, as you said, and have different outcomes in the end. That is your own personal journey, and it can be just fantastic as well.
I wanted to add a little bit to that. Kind of what you just mentioned is the mom guilt. I think it's really common for people to feel guilty or feel like, what's wrong with my body, or something's wrong with me. And I think it's important for people to remember that it's not their fault. It's happening to you. It's not your body's fault. And I think it's important for people to remember to talk about it and remember that it's okay to talk about it. I think it's something that's being talked more about now than it was even when we were going through this. Just the amount of women that I've even spoken to about miscarriages or their IVF journeys or infertility, like it's not roses. It's not always perfect. There's a lot of health stuff that comes with it and things that can happen. And, the crazy thing was when we were going through our infertility journey, I didn't even realize my best friend was going through a similar thing. Wow. Because we were both afraid to talk about it. And so I think it's just a reminder that it's okay that you're going through it and that you should talk about it.
And if anyone else is listening to this is why we're doing this recording today, this interview today, because we want these to be topics of conversation, to normalize this experience. I'm so grateful to be able to host this, and I've learned so much and supported so many others now through stillbirths, through miscarriage, through IVF, and now we're going to add to these unique journeys, fostering and potentially adopting as well. Olivia, Willie, thank you so much. My goal would just be for retail pharmacists to have this information readily available at the counter, just like we do with medication treatment. if somebody wanted to look into being a foster parent and you didn't have family connections as you do, where do you go? Do you just Google what's nearby? What would be the best place to find information?
Yeah, I think it varies depending on where you live. Definitely checking out just local foster care facilities or foster care information. It just varies depending on where you live.
So it's often through your own county. So I guess you could even just, Google foster care with your own county. That is the case, for us that with the county that we're in. You could even go to adoptuskids.org. They have, a whole bunch of resources there that can point one in the right direction as well. Because I do think, this is very important to, share with our audience. And, like I said, even if it can impact one person, then, this is meaningful work.
Olivia Willie, thank you so much for sharing your story, your journey. It has not always been easy, but these outcomes, the family you've created is just one to be admired. And I greatly appreciate your time today and supporting others going through a difficult path as well. Thank you so much.
Thank you.
Thank you.